Osteoarthritis is fairly common since most people over the age of 30 have X-ray signs of this degenerative disease somewhere in their body, even if they are asymptomatic. But how fast it advances and how much pain you actually feel from it depends on how you treat it. According to Dr. Kenneth Adams, taking pain relievers, anti-inflammatories like ibuprofen and Celebrex to relieve mild to severe pain can depress the body's own ability to heal. In our late 20s and early 30s, says Dr. Adams, body processes slow and aches and pains begin. But instead of medicating ourselves while the processes continue to degenerate, we need to nourish ourselves so the degeneration is minimal. Dr. Adams pointed out that in Europe, nutritional supplements are always the first line of treatment instead of anti-inflammatories. Inflammation tells you there's something wrong. Something in your body needs attention. Taking anti-inflammatories to reduce the inflammation from the affected area is treating the outcome rather than eliminating the trigger. Dr. Adams continued, "We've been told for a long time that fat is bad, but the body needs the right kind of fats to keep the processes moving, like greasing the squeaky wheel. Essential fatty acids, or EFAs, are truly essential to keeping the body in good shape." Neurosurgeon Joseph Charles Marone, team physician to the Pittsburgh Steelers, studied 250 patients with chronic low back pain. Each of them had consulted a neurosurgeon and was found not to be a candidate for surgery. All were taking non-steroidal anti-inflammatories, or NSAIDs. Dr. Marone treated them with EFAs, fish oil, 1,200 milligrams daily, and asked them to complete a survey after they had taken it for a while. According to the study results, of the 250 patients, 125 returned the questionnaire at an average of 75 days on the fish oil. 78% were taking 1,200 milligrams, 22% were taking 2,400 milligrams of EFAs. 59 patients discontinued to take their prescription NSAID medications for pain. 60% stated that their overall pain was improved, and 60% stated that their joint pain had improved. 80% stated they were satisfied with their improvement, and 88% stated they would continue to take the fish oil. There were no significant side effects reported. One of Dr. Adams' patients gave him this report after he recommended a course of EFAs for her. "My knee pain was so severe, my other doctor wrote me up for light duty, and I was beginning to get some kind of rotator cuff pain that was making my right arm go numb. My employer told me there was no light duty. I had to either quit my job or find another solution. I came to Dr. Adams and he put me on essential fatty acids. I couldn't believe it. In just 3 weeks, the arm pain was completely gone, and the swelling and pain in my knee had reduced enough for me to continue pounding those concrete floors at work." Most people find few solutions to osteoarthritic degeneration and pain from their regular doctors. Rest and anti-inflammatory seems to be all they offer. Rest is good initially, but it should be supplemented with EFAs to repair the process, and then a rehabilitation plan that works on stretching and strengthening. Anti-inflammatories alone can ultimately cause significant GI problems. Take them long enough and they can result in bleeding ulcers, reflux, and even death. Ibuprofen, an anti-inflammatory medication, is the single leading cause of medication-induced death in the United States. Your mother was right about the cod liver oil, but osteoarthritis treatment doesn't have to be unpleasant. Research has produced some very palatable ways to get enough EFAs to treat osteoarthritis, from capsules to flavored smoothie packets.